Hi Jellybeans! I hope you're all doing well. I am Joy G and welcome back to my channel. So for today's vlog, I have prepared a list of those mga common terms and abbreviations that I was able to learn and pick up in the unit that I'm working now, in the hopes that, especially to those aspiring UKRNs, you will find this vlog helpful and beneficial as well. And I will be sharing a funny experience with you guys at the end of this vlog. And I consider that as one of the biggest blooper in my entire working career dito sa UK. And in the hopes na you're not gonna make the same mistake that I did. Aww. So if that's something that sparked your interest, stay tuned and let's get started. So, number one on my list is meal by mouth or NBM. So, sa Pilipinas, it's commonly used, the commonly used term is parang NPO or nothing per RM, but it's the same. So, that means the patient is not allowed to have anything to eat or drink. So, nothing at all. This usually happens if the patient is parang after fresh from surgery or the patient is for surgery. So that's NBM or meal by mouth. Second is BNO or bowels not open. So that means si patient hindi pa nakapupo. So it might be constipated lang si patient, or if there's some problems that the patient needs to undergo surgery or something. So, but that's it. BNO or bowels not open. At the same time, if the patient had opened her or his bowels, so it means, or we usually say BO or bowels open. So, yun lang, easy. Fourth is CXR, which means chest x-ray. I'm not sure what's the term that we're using sa Philippines, but CXR or chest x-ray. Another thing is DNAR or do not attempt to resuscitate. I think sa Philippines parang DNR lang, but here DNAR. Meron din silang DNA CPR, which means do not attempt cardiopulmonary resuscitation, which means the same thing. So, if mag-arrest si patient, no more CPR na mag-e-effort si medical professional. Next is O/E, which means on examination. So, I usually see this notes ng mga doctor when they visit the patient. They written it down as O/E. So, yun, all their assessments sa patients. Next is LD. Like before, when I had receive a handover from a colleague, LD, hindi ko talaga siya ma-understand. Like, what does it mean, long day? But when I googled it, it means learning disability. So, the patient has LD or learning disability. Next is salt. Salt is not really the asin na we're eating. There are medical professionals which is like salt is speech and language therapist. So we usually like see them sa unit after the patient na extubate and they could not really like their voice is parang husky pa and unsafe for swallowing, so they could not there is risk of aspirations of fluid going to the lungs instead of sa stomach nila, because it's not parang they're getting used to it because nawala yung trachea or yung tube na na-place sa throat nila. So they are the ones who assess if the patient is already safe for swallowing, and they're also the one assessing the voice of the patient, if it's back to baseline na ba, or if there's still hoarseness or medyo husky pa. So there's SALT, speech and language therapist. Another is ATSP. I've always seen this sa parang surgeon's note or parang mga visiting team sa patient. Like when they make an entry, it's always ATSP. So parang what does ATSP? Is it like a blood request? Kailangan ba ng urine sample or something? So when I googled it, it's a basic as asked to see patient. So one of the doctors of the unit maybe rang their team for their opinion, and they came to check the patient. So ATSP, asked to see the patient. Diba? Not complex at all. Next is main. Main is in the morning. So I usually see this sa input sa doctor, let's say seen the patient, and then they have ordered chest x-ray main. So that means chest x-ray in the morning. So MANE, in the morning. Another one is poorly. So I often encounter these words talaga sa unit when they say my patient is poorly. So that means parang complicated or very sick si patient, or maybe the sickest patient sa lahat. So poorly si patient. Next is sick. Dito or sa Pilipinas, when we say na I am sick, that means you're not feeling well, or maybe you're having a fever or something. But dito, when they say I feel sick, that means they are about to throw up or they are about to vomit. So you have to prepare na tissue or vomit balls para hindi mag-splatter all over. So when the patient says na I feel sick, so go na sa mga antiemetics and everything because susuka talaga siya. Next up is OD. This also means once a day for the medication, but for us sa unit, it commonly means overdose or drug overdose. We have been receiving lots of cases as that as well. So OD, overdose. Next up is LMWH, which means low molecular weight heparin. So this is a kind of medication that thins the blood to avoid clots. So this is what I noticed as well as different sa Philippine practice, because parang almost all of the patients who are coming sa unit namin, we really inject blood thinner injections just to avoid parang mga thrombosis or clots while they are staying, because kasi intensive care unit, so medyo the patients are quite poorly and they could not move and mobilize for like a couple of days. So just to avoid that kind of complication, we inject them para therapeutic dose of low molecular weight heparin. So yun, LMWH. Next is AO1. So this one, it means assistance of one. It usually is used para upon transferring the patient or his mobility is being assessed. So AO1 means the patient could not really do it by himself and needs somebody there, one person to do it. Or sometimes they also say na AO2, so that means the patient needs assistance of two people, two medical professionals to help when transferring and moving. So, yun. So, for the story time, for the biggest blooper and hopefully the last parang blooper na I'm gonna be encountering or doing dito kasi nakakahiya siya. So what happened was, I was working in one of community hospitals, which is parang rehab facility siya. So most of the patients there are parang matatanda na, like around 60s to 90 years old. So, I was working on a night shift. So, at 7 in the evening, I was told by one of a colleague na parang this patient in bed 13, parang siya yung pinaka-poorly and you have to look to watch out for. Kasi 95 years old na siya and parang talaga, like medyo sick talaga si patient. So, pagdating ko, when I did my assessment, tulog lang siya. Like, tulog, kalmado lahat, so everything. And then, wala siyang medications for the whole night. So, I was just sitting across her. And then, by the time, by 4 o'clock in the morning, parang ko kasi she was raising her hand. So, I thought parang lang. It was like a voluntary movement maybe, or baka nananaginip lang siya or something. So, parang wala lang ako. And then, when I did my rounds to check everybody, she was raising her hand talaga and her eyes was open na. So, I approached her and asked if like she's okay. And then parang when I was asking those questions, parang she was quite muddled. She was like parang confused. So parang I was telling to myself na, I think confused si patients kasi incoherent yung mga words niya. So wala lang. And then I told her na it's still 4 o'clock in the morning. Still too early parang to wake up and start the day. So you might want to go back to sleep. So yun. And then I went back and then did my documentation and all my nursing care. And then nag-move na talaga siya, like parang babango na siya. So I asked her again if she's okay, and she told me this line, I need to spend a penny. So sabi niya, I need to spend a penny. So parang ako, nag-loading ako na, ay, confused talaga si patient. Why would she spend a penny na? It's like 4 in the morning. She's in the hospital, you know, like, where would you go to buy something? So parang ako, it's still 4 in the morning, go back to sleep. So there, wala lang si ate, parang walang nangyari. And then at 5 in the morning, I did my drug rounds for those na, kasi matatanda sila, so they wake up very easily, and they wake up very early as well. So I did my drug rounds for 6, and I have like 11 patients that time. So, yun. Well, I was doing my drug rounds. She was raising her hand, and then she was telling me that she needs to spend a penny. So parang ako, I was still doing my drug rounds, and it's a must na parang you should not be disturbed while doing your drug rounds because it's gonna cause drug error. So parang I told her na I'll be with you in a minute. I'll just complete my drug round because I was about to finish na. So yun, and then when I came back, sabi na naman niya, I need to spend a penny. So parang ako, where do you want to spend? What do you want to buy? She was like smiling, and parang she was about to laugh because of my parang innocent question lang. Kasi I have that prejudice na she's confused. So and then I asked, she said again, I need to spend a penny. And then I asked her, do you have a penny with you? So, parang that was the time na parang natawa na siya. And then she asked me, do you have a penny? And then I said, I don't. And then I said, I don't have a penny. And then I left. I went to the kitchen, took my phone, and Googled, what do you mean by I need to spend a penny? And the result is...
Oh no!
Diba? Like, she was telling me that since 4 in the morning na she wants to urinate. She wants to wee. So, ang nangyari is at 6, the bed is wet. She did not make it. Like, you know, I felt really guilty na hindi ko talaga alam na that was it meant. So, I asked the parang healthcare assistant that bed 13 needs somebody to help her. I think she needs to have a wee. But good thing the nurse assistant told me that she's always like that. She wakes up na parang basa na yung bed niya because parang incontinent talaga si patient. So parang consolation ko na yun, but it's still like a no-no na parang kasi ginudge ko siya, na confused siya eh. So yun, that was my biggest blooper. And so the healthcare assistant washed her early in the morning. I changed the sheets and everything na parang wala lang nangyari. So ayun, yun yung biggest bloopers ko, Jellybeans. So I hope you won't commit the same mistakes kasi parang nakakahiya. Like whole day iniisip ko, and I told BFF about it na grabe, it's super palpak. But yeah, yeah, that's it. So that's the end of this vlog. If you like more information or knowledge, let me know so that I can make a part 2 maybe of the things na or the terms that I encountered in the unit and I will be encountering too, so I can share it with you. So yeah, I hope you find this helpful, and I hope you have a lovely day and make good choices. Thanks so much for watching, Jellybeans. Bye!